Bismillahirrahmanirrahim. Welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. Today in this video lecture we are going to see another biochemistry or clinical chemistry test, that is the creatinine test. So what is creatinine test in the blood? Let's talk about that. So before going to explain creatinine test, first of all let's see that what is actually creatinine. Remember, creatinine is the waste product, or we can say toxic product into the body. Okay, it need to be removed from the body. So how it will form? So when there is actually a molecule which we call it creatine is present into the muscle, and when the creatine is break down, creatine is actually the organic acid. So when the creatine is break down into the muscle, then it is converted into the creatinine. Okay, now creatine is actually synthesized in the liver from the amino acid, that is the arginine, glycine, or we can say methionine. So when the creatine is formed from the liver, then it reach to the muscle, and in the muscle when it is break down, so it will provide energy for the muscle cells. Okay, then it will be converted into creatinine. Once it is converted into the creatinine, so then the creatinine will circulate into the blood and reach to the kidney, and then will excrete from the urine. Now remember, when a person have large muscle, it means that it will produce large amount of creatinine. Now let's see that what is creatinine test. Simply, it is the blood test or biochemistry test or clinical chemistry test in which we measure the level of creatinine into the blood. Then we have the diagnostic purpose, means why this test is performed, why the doctor recommend this test, what is the medical importance of this test. So the first importance or the diagnostic purpose of this test is to diagnose the kidney function and the diseases. Okay, so whenever you want to check the kidney function or diseases, you have to perform the creatinine test. Next we have the muscle disorder. So if you want to check that either the muscle have any diseases or disorder, so you have to perform creatinine test. Next, if you want to check that either the glomerular filtration is working properly or not, so it is important to do the creatinine test. And next we have the renal function or kidney function. So for the kidney or renal function, we also perform creatinine test. Next we have the test procedure. So the creatinine test is performed using a fully automated machine like we have Selectra, and we can also perform this test on semi-automated machine like we have Microlab 300 machine. So in this video we are going to see that how to perform the creatinine test on Microlab 300 machine. I already explained the Microlab 300 machine and Selectra. The video lecture will be present into my channel. You can go back and watch the video related to Selectra and Microlab 300 machine. Let's see that how to perform creatinine test on Microlab 300. Before going to explain the procedure, first of all let's see that what we need while performing that test. So while performing that test, we need the creatinine kit that is available in Inulin company, as you can see. Okay, green cap and white cap. This is R1 and R2. We need a calcium tube. Okay, we need a yellow tip, as you can see. We need blue tips. We need blood. Okay, so we have to take the blood into red cap, as you can see, red top tube. We can take the blood in a heparin tube or green top tube, and we can also take the blood into a gel tube, or we can say yellow top. Okay, we need a pipette, or we can say jester. Okay, and we need as you can see, we need Microlab 300 machine. So this is the Microlab 300 machine through which we will perform the test. So I already explained the Microlab 300 machine. You can go back to my channel and watch the video. We also need the centrifuge machine through which we will centrifuge the blood and will separate the serum. Okay, so this is the requirement. Now let's see the procedure. It's very simple. First of all, you need to take the calcium tube and you will add the reagent, means R1 and R2. Okay, so this is the R1. You take 500 microliter R1, and similarly you have to take 500 microliter R2, means reagent 2. You will mix it into the calcium tube, as I already mix it. Okay, then what will you do? you have to take the jester and you will set it onto the 50 microliter. Okay, so now the jester is already fixed at 50 microliter. Then what will you do? You take the clean yellow tip and will take the serum. Okay, so here I am taking the heparin tube. So in heparin tube we get the plasma. So then we can also perform the test from the plasma as well. Okay, so then you will take the serum from the heparin tube, plasma from the heparin tube, 50 microliter. Okay, so once you take it, so then what will you do? You have to add it into the this calcium tube having the R1 and R2 kit. Then you will mix it. Okay, next what will you do? You have to label it with the test name as well as with the patient ID. Then you will incubate it into the dry incubator. Okay, and after that you have to set the watch time. This is the stopwatch. Okay, the test should be, take after 30 seconds to 1 minute. Then you will read the test. Okay, now how to set the machine for the test? It's very simple. First of all, you go to the test list and here you will click creatinine. So you will click on enter, then you will give water. So it will measure the water as a blank, and it will wash, the machine will wash theirself and will ready theirself for the test. After few seconds the machine will be ready. So as you can see, the machine is now ready for the test. Here the machine is said to standardize it, means that you have to standardize it. You have to guide the machine that you have to give the result between this range. Okay, so I already standardized, so I will skip this. Okay, then what will we do? We have to dip this straw into the kit and will press the button. So it will suck almost 500 microliter, and after few seconds it will give you the result. So as you can see, we get 0.1. It means that we get low creatinine. Okay, now this is how to perform the creatinine test. Now let's see the normal range. So normal range is very lab to lab, kit to kit, age to age, and sex to sex, we can say. So at the below 2 year, the normal range of the creatinine is 0.1 to 0.4 microgram per deciliter. Next we have at the age of 2 to 6 year old, so the creatinine level is 0.2 to 0.5 mg per deciliter. So at the age of 7 to 10 year, the creatinine level will be 0.3 to 0.6 mg per deciliter. Now at the age of 11 to 18 year, the creatinine level into the blood will be 0.4 to 1.0 microgram per deciliter. In case of female that are older than 18 years, so the creatinine level will be 0.5 to 1.0 mg per deciliter. So in case of the male older than 18 years, so the creatinine level will be 0.6 to 1.3 mg per deciliter. So this is the normal range. Now let's see. Next we have the main causes of high creatinine, means in which condition or in which diseases, or we can say how the creatinine level get high into the blood. So let's explain this condition. So the first condition is the nephron damages. Okay, we better know that nephron is the kidney cells, so and it is important in the filtration, means it will filter the blood. So when the nephron get damaged, so the blood will be not filtered, and due to this way creatinine level will get high. Next we have acromegaly and giantism. It is actually the condition in which the growth hormone will increase, and due to this way one organ, like we can say the hand or any part of the body, will get enlarged. So in this case, as you can see, the hand get large from its normal size. So this is called acromegaly, and we can say giantism. The difference is just that acromegaly will occur in the adult and giantism will be occur in the baby, or in case of in newborn, or we can say. Next we have hyperthyroidism, in which a lot of hormone will be secreted from the thyroid gland. Next we have congestive heart failure, in which the heart doesn't have the ability to pump enough blood that is needed for the body. Next we have urinary tract obstruction, like stone formation into the urinary tract, due to which the creatinine level will get high. Due to acute and chronic renal failure, or we can say kidney failure, kidney is also important into the blood filtration, so when it get fail, so then creatinine level will get high. Next we have poliomyelitis, like polio virus, it will also increase the creatinine level high. And last we have burn, so due to burn, the creatinine level will also high. Next we have the main causes or the condition or the diseases, or in which condition the creatinine level get low or get decreases. So first we have muscle dystrophy. So it is the condition in which the muscle will be degenerated, or we can say weak. Okay. Next we have liver diseases. So in case of the liver disease, the creatinine level will also get low. Next we have low protein. So when we take low protein in a diet, it will also cause the low level of the creatinine. Next we have age increasing. So when the age is increasing, so it will also cause low level of the creatinine. Now in case of pregnant women, the creatinine level will also get low. So this is all about the creatinine test, that what is creatinine, creatinine blood test, medical diagnosis, test procedure, each and everything. I hope you understand, and I hope you like this video. If you like this video, so make sure to hit the like button, share this video with your friend, and also subscribe the channel and press the bell icon to get more interesting videos like that. Thank you so much for watching.